Hi, my name is Teresa Shishka, and I'm going to be your nurse practitioner, your student nurse practitioner today. Before we get started with your exam, I would just like to take some time to get to know you and understand your health a little bit better. I'm going to ask you a few questions if that's okay. We're going to chat for about 10 minutes or so.
Sure.
Sure. So I'm going to close the door. I'm going to pull the curtain to provide privacy, and I'm going to use some hand sanitizer on my hands just to keep my hands nice and clean. So first of all, I want to verify that I have your information correct. You are Richard Mashishka, and your date of birth is 8/15/1981. Is that correct?
Correct.
All right. And how would you like to be addressed today?
Rick,
Rick. So what brings you in today, Rick?
follow-up well visit.
Follow-up well visit. And overall, how are you feeling today?
Pretty good.
You're feeling pretty good. All right. Are you having any pain?
Just in my neck.
Are you having any pain?
Nope.
No pain. All right. So tell me about your health. Did you have any medical conditions now or back when you were a child?
Nope.
No child. How do you feel about your overall current health now?
Good.
Good. All right. And do you have any recent illnesses or injuries?
I have a herniated cervical disc.
Ooh, a herniated cervical disc. And you'll just see me jotting down notes so that way I will remember everything that we talked about today. Who do you see for this herniated cervical disc?
Dr. Lalama.
All right. And what kind of treatment are you getting for this?
We are doing chiropractic adjustments, and I sought a consult for a weekly epidural shot.
Okay. All right. And have you had any surgeries?
Within the last how long?
Lifetime. Have you had any surgeries during your lifetime?
Yes, I've had my tonsils removed. I've had
Were those tonsils as a child?
teenager.
Teenager. Okay.
And I had a inguinal hernia repair.
Oh, hernia repair. And that was approximately what year?
2017.
2017. All right. I would like to know a little bit about your family history health. Do you have anyone in your family that has any medical conditions, such as heart disease, diabetes, a history of stroke?
Diabetes and high blood pressure.
Who had diabetes and
My mother.
And how about the high blood pressure?
Mother.
Mother. Any history of cancer in your family?
Yes.
Yes. Who?
Father.
And what kind of cancer?
Lung.
And has anyone in your immediate family passed away? Siblings, parents,
My father.
father? And what year was that?
2020.
And do we know the cause?
Heart failure and COPD and lung cancer.
My condolences. Do you have any allergies?
Seasonal.
Seasonal? Any allergies to medication?
Penicillin.
And what kind of reaction happens when you take penicillin?
I don't know.
Unknown. Okay. And what happens with your seasonal allergies?
Just your typical hay fever. Things like that.
So like the itchy
Runny
eyes,
nose, yep.
runny nose. Okay. Are you
I
currently...
have other medication allergies.
What are medication allergies?
Cipro
Penicillin, Cipro.
and sulfa.
Okay.
That's it.
And do you know what the reactions are when you take those
Cipro
medications?
cause my face to swell. The sulfa made me break out in a rash.
Okay. All right. Are you taking any medications on a regular basis?
No.
No. All right. Can you tell me about your job?
I am a correctional officer.
And what kind of hours do you work?
4 in the morning till 2 in the afternoon.
How many days a week?
4.
4 days. All right. Are you a smoker, drinker, or do you do drugs?
Nope.
And what is your highest level of education?
I have a 4-year degree in accounting.
And what do you do for fun?
Wash my wife's clothes.
Well, that could be a fun job if she's got a lot of clothes. All right, sir. I'm just going to get into your overall assessment now. I'm just going to ask you some questions. If you have any symptoms, just speak up and then we can explore that topic further. So have you had any fevers recently, any unexplained fatigue, chills, or body aches?
Nope.
No. Do you wear glasses or contacts?
Occasionally.
Like reading glasses?
Yep.
Do you experience any blurred vision, any spots, any floaters in your vision?
No.
No double vision?
Nope.
Okay. How is your hearing?
I'd say average.
Average. All right. And how often do you see a dentist?
Once every 2 years.
Okay. Once every 2 years. Do you get any sores or lesions in your mouth?
I do not.
Do not. All right. Have you noticed any lumps or bumps in your neck or anywhere in your area here?
Nope.
All right. As far as your lungs, do you have a cough?
Nope.
Any shortness of breath or shortness of breath on exertion? Outside the
No.
normal exercise?
Not really.
Not really. Have you had a chest x-ray in the past?
Maybe as a child.
Child. All right. Do you have any chest pain?
No.
Any feelings of palpitations or fluttering in your heart?
Nope.
No. And you have not been told you've had high blood pressure?
Nope.
All right. How is your appetite?
Too strong.
Too strong. You have a healthy appetite. Any changes in how's your bowels? Are they normal?
Normal.
Normal. No constipation, no diarrhea?
Nope.
Okay. How is your urination? Any hesitancy, any burning, any
Nope.
frequency?
Average frequency.
Average frequency. Have you ever had any kidney stones?
Nope.
Any history of diabetes or thyroid?
No.
Any concerns about your skin? Do you have any rashes now? Any lesions? Any unexplained bruising?
Nope.
Do you get any backaches or muscle cramps?
No.
No. Have you ever broken a bone?
My nose.
Nose. And that was as an adult or a child?
Young adult.
Any pain or stiffness in your joints?
Nope.
No? Okay. Do you have any concerns about your genital areas?
No.
No. Do you perform testicular exams?
No.
Okay. And have you ever been treated for an STI?
No.
Do you have any abnormal bleeding?
Nope.
Have you ever had a blood clot or a recent blood transfusion?
Nope.
Do you get any headaches?
Just doing laundry.
Your wife's laundry?
Yep.
I guess that would give me a headache
Very
too.
stressful.
Very stressful. Have you had any changes in your ability to think or remember?
No.
No. Any weakness, any seizures, any sudden mood changes?
No.
Not even when you're doing laundry?
Just when my wife gets home.
Just when your wife gets home. Okay. And how do you feel emotionally overall?
Very positive.
Do you have a lot of stress in your life?
Just the one person.
Are you able to deal with that stress? How do you deal with it?
Work overtime.
You work overtime. All right. What brings you enjoyment?
I don't know.
You don't know. We'll have to work on some self-care issues. Maybe bringing in a
Self-care.
little self-care. Maybe have your wife do her own laundry.
I don't think that's a possibility.
All right. Have you ever had any thoughts about self-harm?
No.
No. All right. Those are all the questions that I have for you right now. Is there anything else that you would like to share with me?
Nope.
Do you have any other questions or concerns?
No.
All right, sir. Thank you. And thank you for your time.
All right.